So the World Health Organization on Monday temporarily halted trials on hydroxychloroquine, which is a anti-malarial drug which was being tested to see whether it helps patients who were infected with coronavirus disease to recover faster and whether it actually prevented death. Now, this decision was taken when a large study done by the Lancet, which looked at several studies from across the world, which had enrolled about 96,000 patients, and the study published in the Lancet found that people who were getting hydroxychloroquine were dying more than patients who were not. So they kind of alerted that patients were at a risk of irregular heart rhythm or an arrhythmia, and they were at greater chances of death. So which is why the WHO decided that though the trial done by the Lancet was not a randomized controlled trial, which is the gold standard for testing any new drug or vaccine, it was an observational study where they looked at data after the event had happened. But they said still, because it involved multiple registries across the world and a large number of patients, like I mentioned, 96,000 patients were observed. So the WHO said that the data was worth reviewing, and they needed, although their own study hadn't shown that hydroxychloroquine was dangerous for patients, but they said as a precaution, we have decided to suspend these trials till they review data, and they're going to be reviewing this data over the next week or so, according to who's chief scientist Soumya Swaminathan. And once the data is reviewed, they'll decide whether they want to continue with the trial or not. So Dr. Soumya Swaminathan said that it's really essential to see whether it's safe and efficacious, whether it works, whether it reduces hospitalization, reduces death without causing serious side effects, which were found in the Lancet review. Now the WHO's own data doesn't show the data collected so far, and of course the Solidarity trial has just started, so they really haven't studied the initial data that's come. But they said over the next couple of weeks they're going to look at the data that's there, and they're also going to look at data from 7 other major studies that are using hydroxychloroquine across the world. And if the data shows that the drug doesn't cause the serious adverse effects that were found in the Lancet review, then they may resume the trial in a week or so. But as Mike Ryan, who's the head of WHO's Health Emergencies Response, said that we need to move with caution, and if there's any problem with the medication, there's need to stop it. And it's also important to continue to gather evidence on the effectiveness of this drug. There's a reason why India is very closely following all evidence related to hydroxychloroquine, and that's because India is the world's largest producer of this anti-malarial drug, which has been used to treat malaria for several decades now. And in India, it is given to as a prophylaxis, which means it's given as a medicine to prevent infection to asymptomatic health workers as well as close contacts of people who've been diagnosed with coronavirus disease, to prevent infection. And just recently, last week, this was expanded to include frontline workers, and these are people who are into contact tracing, who come to your home, and other people who are at higher risk of exposure to the virus. So there's several studies also underway in India, and recently when I spoke to Health Minister Harshvardhan, he said early reports from India's own pharmacovigilance program shows that there are no adverse reactions from the use of hydroxychloroquine that have been recorded in India. So as a prophylactic drug, which is as a drug to prevent infection, it's shown to actually protect people from infection, and that's what data from hospital-based studies, like 3 retrospective hospital-based studies found in India. And so far, according to the people in the Indian Council of Medical Research, the scientists there said that it does not cause adverse effects in healthy people. But in India, it's not used to treat people who are hospitalized. But they said the studies are going to continue, and once we have more evidence, we will know. So the trouble with any new disease is we don't know enough about the disease. That's why it's very important to take every bit of information that we get very, very seriously. And for all you know, I mean, I may be back next week talking about how this drug is wonderful, or I may be back saying it's terrible and you should stay away from it. But as of now, what we do know is it doesn't help patients with severe disease. Luckily in India, not very many people have severe coronavirus disease, but according to evidence from India, it seems to protect asymptomatic people who are so far healthy, who are not ill, from infection. And that's all we know. As we know more, I'll keep you updated.